Now I would like to tell you a little bit about lymphedema and how it actually can be something that someone after breast cancer treatment may have to deal with. It's really a confusing thing. It's a little frightening. In fact, sometimes I think physicians hesitate to let us know about it because they don't want to scare us. It's not something to be frightened about, but it is something to be educated about so that you can be proactive. What is lymphedema? Kind of hard to understand, but simplified, we have two circulatory systems in our body. One of them is run by a pump, which is our heart, and it has veins and arteries. They're big vessels. I like to think of it as kind of a sewer system. The other circulatory system is our lymph system. They're little tiny vessels, and there's no pump for that. It's more of a vacuum type system. Our lymph is the fluid in our body that removes debris, bacteria, the things our body doesn't want, and it seeps through this septic type system into lymph nodes, which after breast cancer may be ones that were under our arm or on our chest. The system, when it's been altered by any kind of a surgical procedure, a lumpectomy where they've cut through some of the lymph nodes, lymph node sampling up under your arm, a lymph node removal from under your arm, or a mastectomy, any one of those procedures can actually cut that system, cut those small little vessels, and kind of like a beaver in a dam has provided an area where fluid can get blocked. And so fluid will seep down but can't get vacuumed back up, and then swelling occurs. So that's what lymphedema is. It's swelling from the lymph system. We have several ways to actually treat and remedy that. I have lymphedema actually in this arm. I'm one of the lucky ones that has it well enough controlled that I only need to wear a compression sleeve in certain circumstances, which I will talk about. Other people may develop their lymphedema and actually have to wear compression garments all the time. One of the things that people don't understand about lymphedema is that they think if they've only had one lymph node removed or they had surgery 2 years ago, that they are no longer at risk for that complication. This is actually a lifetime complication. It is one that can occur directly after surgery, or it can actually spring up 10 years down the road. So it's one that we need to know about, be proactive about, and always on the watch for. In fact, as a navigator, I usually recommend that women getting ready to go under surgery have a consult with a physical therapist that can talk to them about things like range of motion and scar tissue, as well as lymphedema precautions, and do a measurement. I think it's really, really valuable information to have measurements of your arm prior to surgery, so that if lymphedema starts developing, we can know right away when it's at a minor collection of fluid as versus a big swelling area. There are garments, you've heard me mention the compression garments. After breast cancer, we have several sleeves that can be used. We also have gloves and or gauntlets, which are like a glove without the fingers in them. Sometimes we do have compression bras that will take care of swelling that's in the chest area and up under the arm. I would like to show you how to put the garment on. They're a little bit tricky. You will be measured exactly specifically for what size you might need, and as it gets controlled, that sizing actually can shift, it can change. Typically, most women will wear a sleeve during the day when they're up and about and active. They may not need to wear it at nighttime at all. There are risk factors that would trigger lymphedema, and ones that you need to be aware of. Things like a blood pressure cuff not being on the arm where you've had surgery, a blood draw where you've had surgery, a bee sting, or a cut or a scratch that can become infected. Those things are ones that we have to be incredibly cautious about because that can trigger lymphedema. Flying, barometric pressure changes can make a difference. Lifting heavy weights can make a difference. So there's all kinds of things that we can educate you about here. A physical therapist would also educate you about on the consult. I'd like to show you now. I'd like to put a sleeve on a patient I have here who actually does have lymphedema. You will notice when you see her arm that it is swollen. There is some swelling here. There's a lot of swelling up here. And what we're going to do is put a compression sleeve on that actually assists in bringing that fluid back up into the system, where the lymph fluid can then be traveled down into the major vessels that then is reabsorbed and excreted as fluid through our kidneys. So when you put a sleeve on, you're going to have it out full completely like this, and you're going to take the sleeve and actually fold it in half. You have the little band that's got little rubber balls on it to hold it upright. Fold it outward and you come up through the hand. This is actually easier for many women to have an assistant to put it on. Now when I put it on, I anchor the arm under my arm. You bring it up kind of as high as you can, and then you go ahead and take the other part and pull it up. And you go up as high as you possibly can. It should feel snug. You should have an accurate measurement of what size it is you need. The physical therapists are trained in knowing how to measure. They will measure this diameter of your arm. They will measure here, and they will also measure the wrist. They also measure a length. They make sleeves in what we call a regular length and or long. This one is down a little bit low. I didn't get it all the way up, so I'm going to kind of take it here. And then I'm going to show you a little trick. Especially when you're alone and you're having trouble getting it up, a rubber glove will actually help you to scooch it up without making little holes in it. Getting the wrong size can be very, very detrimental. In fact, a sleeve, if you have swelling up here and here, but not necessarily swelling down in your hand, but you go out and purchase a sleeve on your own that you think feels pretty good, it's got a lot of pressure in it, but it's too tight, it's not giving you the correct pressure, you can actually make your hands and your fingers swell immensely. A sleeve that's too loose is not going to assist you, it's not going to actually relieve the problem. So it's really, really important that you actually get the size that's appropriate for you. And as I mentioned before, as your lymphedema gets controlled and it comes down, you may actually find that you go to a smaller size. They do say that for the most part, if you're a woman who needs to wear a sleeve every day, that it needs to be replaced at least once every 6 months. Sadly, these garments are not covered very easily with insurance. In fact, most insurances do not cover them, which is one of the reasons that we do have the sleeves here, and we will assist you in any way that we can to make sure that you have what you need. They typically cost in the range of $75 to $85 per sleeve. So that can be high if you're living on an income that doesn't accommodate that. So this is what your sleeve should look like. So this is an arm without the lymphedema. This is an arm with. This is a patient who has had a mastectomy 9 years ago. She did not have any lymphedema after surgery at all, but 2 years afterwards did develop some. So she's known about the sleeve. Now, just recently, she had a bee sting that got her on the arm, and that triggered a big flare-up of her lymphedema. We're 9 years out past surgery. She got such a bad bee sting that it actually became infected. It's what we call a cellulitis. She did need to be hospitalized. She had IV antibiotics, and now needs to be very diligent about making sure she has her sleeve on. Typically, you'll wear your sleeve all day, and at night you take it off and let your skin rest. You might elevate your arm on a pillow to help with that fluid drain, but that's the typical pattern. Your physical therapist would help to let you know exactly when you should have it on and not. The lymphedema that I just spoke about is primarily for breast cancer patients, but we do have women who have had other types of lymph node removal, which again is a disruption in that ability for that system to flow the fluid. If you've had anything to do with the lower abdomen and or your legs, you may have had lymph nodes removed in the groin area. That can cause lymphedema of the legs, and we have compression stockings that will assist with that.